A video script. You can ace every cognitive test, hold a full-time job, raise a family, and laugh at dinner, all while a blood clot is quietly forming inside your brain. How is that possible? Because your brain doesn't send you a warning email. It adapts, compensates, and masks the damage until the moment it can't. This is why for nearly a third of all stroke victims, the very first symptom isn't a headache. It's waking up unable to speak. In this video, I'm going to show you why the healthy brain fails, how your body hides these ticking time bombs, and the only way to actually check your brain before it's too late. To understand why a healthy brain fails, we have to strip away the skull. When we study the anatomy of the brain, we see an organ that consumes 20% of your body's entire oxygen supply, despite being only 2% of your body weight. To feed that demand, it relies on a network of vessels that snake through its tissue like river systems carved into a canyon. Early anatomists noticed these vessels formed a circular junction at the base of the brain. They called it the Circle of Willis. But I want you to think of it differently. Think of your brain's blood supply as a city's electrical grid. Every neighborhood, your speech center, your motor cortex, your memory, has its own dedicated power line. Cut one line and that neighborhood goes dark. Cut the main trunk line and the whole city loses power. We have two main systems here, the carotid arteries feeding the front and sides, the vertebral arteries feeding the back. The back controls balance and vision, the front controls speech and movement. A blockage in the middle cerebral artery, one of the largest front branches, is the brain's equivalent of the Widowmaker. It supplies the hand area, the face area, the language center. Block it, and a person loses the ability to move their right arm, form words, or understand speech, sometimes all three at once. But how does a blockage form in someone who eats well and never smoked? To understand this, we zoom into the vessel wall. A healthy artery is like a brand new rubber hose, flexible, smooth, frictionless. The inside lining, the tunica intima, is coated like Teflon. Blood cells glide through without friction, but life is not perfect. Over decades, high blood pressure acts like a pressure washer blasting that lining at full force, 24 hours a day. High blood sugar makes the walls sticky and brittle. Even chronic stress floods your body with cortisol, which inflames the vessel walls at a cellular level. These are microscopic injuries. You feel nothing. Your body tries to repair them. It sends LDL cholesterol to patch the damage, like spackle on a cracked wall. Then the immune system sends white blood cells to inspect the repair. Those cells absorb the cholesterol, transform into foam cells, and calcify. This hardened mixture of cholesterol, calcium, and cellular waste is plaque. The condition is called atherosclerosis of the cerebral vessels. Here is the misconception that gets people killed. Most people picture this like a clogged drain. They assume they'll feel the blockage growing, a slow headache, a creeping fog, some warning sign. That is logical. It is also completely wrong. As plaque accumulates, the artery wall expands outward to maintain the opening. This is positive remodeling. The tube stays wide open, blood flows normally. You feel nothing. You ace your cognitive test and feel completely fine because the blood is still getting through. This is why stroke strikes 40-year-olds in the middle of a workout with no prior history and no warning. So what flips the switch? It comes down to one word: stability. Imagine that plaque deposit as a blister beneath a thin layer of skin. The outer shell is fragile. Inside is a soup of inflammatory material, oxidized cholesterol, dead immune cells, and calcium crystals. If blood pressure spikes suddenly, during an argument, during sex, during a heavy deadlift, that thin skin tears. This is a plaque rupture. When the plaque ruptures, the contents spill into the bloodstream. The body panics. It sees a gaping wound and floods the area with platelets to clot the blood. This is perfect if you cut your hand. It is catastrophic inside your carotid artery. Within minutes, that clot seals the vessel completely. Blood flow to an entire region of brain hits a brick wall. This is an ischemic stroke. Without oxygen, brain cells don't die slowly, they die fast. Every minute of untreated stroke, approximately 1.9 million neurons are lost. Not damaged, gone. Permanently. That's why in the ER we don't say time is muscle, we say time is brain, but there is a second, sneakier scenario, and it kills people who think they're perfectly healthy. Consider a 47-year-old woman named Elena. She exercises 5 days a week, normal cholesterol, non-smoker. One morning she wakes up and her right hand feels strange, slightly numb, slightly weak. She assumes she slept on it wrong. It passes in 20 minutes. She goes to work. What Elena didn't know is that she just had a transient ischemic attack, a TIA, a mini-stroke. A clot briefly blocked an artery, then dissolved before permanent damage occurred. Her body fixed itself. She felt fine. But here's what the statistics say. Within 48 hours of a TIA, approximately 10 to 15% of patients have a full stroke. The warning fired. She didn't hear it. This brings us to the hidden accomplice, atrial fibrillation. Your heart runs on a coordinated electrical grid. Every beat is a synchronized squeeze that pushes blood efficiently to the brain. In AFib, the upper chambers stop beating and start quivering. Instead of clean, forceful pulses of blood, you get chaotic turbulence inside the heart chambers. Blood pools, pools clot, clots travel. When a clot from the heart launches into the carotid artery and reaches the brain, this is a cardioembolic stroke, the most severe type. An AFib can be completely silent. No palpitations, no dizziness, just a quivering heart and a clot quietly forming in the left atrial appendage, waiting. This is why a stroke from AFib often strikes without any prior symptoms at all. Now here's the good news your brain has been hiding from you. Your brain has a backup system, collateral circulation. Think of your main arteries as highways. If one highway is gradually narrowing over years, your brain quietly paves side streets to reroute blood flow. This is why some 75-year-olds survive strokes that paralyze 45-year-olds. The older brain had decades to build detours. In a younger person, the rupture is sudden, the highway closes, there are no side streets, no detours, no second chance. One of the best ways to force those backup vessels to grow is aerobic exercise, consistent, moderate-intensity cardio. Exercise doesn't just protect your heart. It literally rewires the vascular architecture of your brain. But if you can't feel it building, how do you find it? Here is the screening strategy. Standard blood work tells you what's in your blood. It does not tell you whether it's sticking to your walls. You need better data. Carotid ultrasound, a 10-minute scan that measures the thickness of your carotid artery wall. Thickening is the earliest visible sign of atherosclerosis, years before a stroke. CT angiogram of the brain vessels. This sees the soft plaque, the unstable blisters that haven't hardened yet, the invisible ones, the ones most likely to rupture. Holter monitor or continuous ECG patch. Worn for 14 to 30 days, this catches silent AFib that a routine EKG will completely miss because AFib comes and goes. Blood pressure monitoring, not once in a doctor's office. At home, resting, morning and evening for 2 weeks. White coat hypertension is real. What your doctor sees and what your arteries experience every night at 3 a.m. are two completely different numbers. The healthy stroke is almost always a tragedy of ignorance. Control your blood pressure, because chronic high pressure is sandpaper on your arteries every single second. Manage your blood sugar, because glycated vessel walls are fragile vessel walls. Move consistently, because movement is the only proven stimulus for collateral vessel growth. And don't guess. The technology exists to see inside your arteries before they fail. Use it. Because your brain will not warn you. It will compensate, adapt, and stay silent, right up until the second it goes dark.